Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-943-9673. That's 877-943-9673. Here's your host, Dr. Michael Lange.
Okay, good morning, and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange, as usual, each and every Saturday morning live for, close to 28 years, to answer your questions regarding vision, eye care, and any nutritionally related topics. So pick up the phones and give me a call. Remember, we have a relatively new phone number, not the same number we've used for the last few years, since we're actually hosting this from new studios. I've been here for over a month now, the Salem studios here in Tampa Bay, beautiful studios. So the phone number, if you'd like to give me a call, remember the participation is encouraged. This is a live call-in show, is 877-943-9673. That's 877-943-9673. Remember, the first hour, we're on the regular stations throughout Florida. I mean, just about the entire state of Florida, Georgia, Alabama. We can pick up a lot of those areas. And then the second hour, you're going to switch your dial from 8:20 a.m. to 8:60 a.m. If you're on FM stations up north, then you could probably just go to Facebook and check things out, or Instagram, or Twitter, or LinkedIn. We might not be live on LinkedIn, but you can go to my Facebook page. That's Fortifeye Vitamins on Facebook, or Michael Lange OD on Facebook, or Dr. Michael Lange on Facebook. Any of those, you can watch live video streaming as well as hear me. Or you can go to any of my websites. I think there is a section you can hook up on there as well. I do recommend follow me on Instagram. I do a lot of freebies on Instagram. A lot of my Facebook pages are already followed, as many as you can, but you can follow me on certain Facebook pages. But Instagram is simply Dr. Michael Lange _ Dr. Michael Lange _ at Instagram. All right, one more time, I'm going to give you the phone lines. 1-877-943-9673. That's 877-943-9673. I'm the founder of Lange Eye Care and Associates and the Lange Eye Institute. Also, Fortifeye Vitamins and Paleo Simplified are my companies as well. All right, we're going to go to the phones. First caller of the morning, I am sure, is going to be Bob. Bob, good morning. Welcome to the program.
Good morning, Dr. Lange. How are you this morning?
Very good. How you doing?
I'm doing wonderfully well. A little cool in the air this morning up here in Ocala, but, not bad for middle of December.
Yeah, it's not bad here in Tampa. It's probably 75. It's going to get up to 80s here in Tampa, I think. It's a little wet out, but it's going to be a pretty day here.
Well, we needed some rain. I hate to say that. I don't much care for it generally, but we needed some bad. We got some sinkholes opening up in the villages, and not good.
Those villages aren't going to like that.
No, they don't respond well to things like that.
That combined with the wild hogs that are eating up their grounds, they're all getting a little uppity.
Yeah, a little nasty. Something's going to happen. Dr. Lang, this morning I had a question regarding CoQ10. I drive for a living a couple, 2-3 days a week, and I've been finding it very difficult to stay awake late in the morning and early in the afternoon. And I tried to get a caffeinated soft drink, and quite honestly, that really didn't do much. But I picked up one that had CoQ10 in it this week, and it's really seemed to keep that dreariness when I'm driving away. Does CoQ10 have that effect?
Well, it kind of indirectly it does, okay? Believe it or not, CoQ10 is a substance that's actually naturally present in the human body. It's highest in the heart, the liver, the kidneys, and I think the pancreas. There's not a lot of CoQ10 in the eye, okay? And it is responsible for mitochondrial functioning. So CoQ10 helps the mitochondria produce ATP. Acetyl L-carnitine, alpha-lipoic acid does that as well. Astaxanthin, which we talk about in this program a lot, has been shown to help produce more ATP. So bottom line, it might be something else in it. For the CoQ10 by itself to help give you energy, just by drinking something, it's probably something else in that drink. You probably had some sort of carbohydrate or sugar, believe it or not, or maybe they had some sort of stimulant in there. Something else probably gave you the energy, because CoQ10 isn't, key for quick energy. But it's certainly not going to hurt you. Another good thing about CoQ10, I'm just going to mention that. I've never mentioned this on the radio, but I have a lot of patients that have migraines. They come in with ocular migraines and migraines, and actually CoQ10 is effective at helping to prevent these migraines. So CoQ10 is good. Somebody that's on a statin drug, first of all, I don't love statin drugs to begin with, all right? But if you're on a statin drug, you should be taking at least 100 milligrams of CoQ10 because statin drug can actually lower and decrease CoQ10.
Oh, my. Okay. Well, I'll keep that under advisement, too. Wake would probably be interested in that.
Yeah, it can reduce the pain and the cramping in the muscles that's caused by anti-cholesterol medications. Mm-hmm.
All right. Well, on that note, if I don't get a chance to talk to you next week, Merry Christmas to you and Tammy and family.
All right. Merry Christmas to you and the gang, too. And Scuba Scott's in the studio, and he said to tell you hello as well.
Say hello to Scott. I haven't seen him in quite some time.
Right. He's listening to you. So you have a great holiday and be safe. I will be racing soon. The next big race, Christmas, the day after Christmas, I'm going to do some practice at Sebring possibly. But the Winterfest is the middle of January at Sebring. It's a big race, and we'll be there for 4 days. So if you're bored, come on down to Sebring on the Winterfest. The main race days that I'm going to be in are going to be Saturday and Sunday.
All right. Very good. Well, be careful, as always, when you get behind the wheel of that animal that you drive.
Always. Pedal to the metal and safety harnessed in.
There you go. Very good. Thanks, Dr. Lang. Thanks for your time.
Take care, Bob. Bye-bye. All right, you're listening to Ask the Doctor this morning. I'm your host, Dr. Michael Lang of the Lange Eye Institute in the Villages, Florida, and Fortifeye Vitamins. If you've got a question regarding your vision, eye care, or nutritionally related topic, now's the time to pick up the phones and give me a call. Maybe you want to share with our listeners something you did naturally that helped you in some way. Phone lines are open, 877-943-9673. Hopefully we're coming in loud and clear in the Villages, and hopefully we're coming in loud and clear up in Gainesville, and that's probably on 97.3 FM, The Sky. I've been on that radio show ever since its conception back, over 20 years ago. So hopefully we're coming in loud and clear. If so, somebody in the Gainesville, Ocala area on The Sky, give us a call and let me know. Once again, that's 1-877-943-9673. I do want to shout out to everybody on the No Name volleyball team. They're an amazing volleyball team. My daughter Mackenzie plays on that team, and a few of their members are actually at a big beach volleyball tournament right now over near the Leesburg area, Howie in the Hills, and it's the Florida Winter Beach National Qualifier. So Mackenzie and Ava are playing in that today and tomorrow. I'm going to try to get over there, possibly go pick Mom up and maybe head over there later on today or tomorrow. But it's the Florida Winter Beach National Qualifier. It's at Hickory Beach Point. It's free to the public. It's December 14th through 15th, so Saturday and Sunday. A lot of world-class, literally world-class volleyball players from Canada and the United States are going to be there. And we'll see how Mackenzie and Ava do. They were second place last year in state championship in beach volleyball, and then they got third in the nationals, which was pretty cool. All right, so I'm going to talk a little bit about dry eye syndrome. I talk a lot about that on this program because, quite frankly, everybody watching me on the internet right now, you're on one of the social medias, you're getting dry eyes because you're not concentrating on blinking. You're concentrating on what's coming over the screen, watching me. You're doing whatever you're doing on the internet. And so a lot of you do get eyes that feel sandy, gritty, burn, tear, itch, fluctuation in vision, sometimes clear, sometimes blurry. All that's related to dry eye. So we're going to talk about a new procedure that's available for dry eye in just a second that we're doing at the Lange Eye Institute. We're one of the first in the area to do this. But a natural approach for dry eye is certainly drink more water. None of us are drinking enough water. We're all dehydrated, and that's one of the root causes of a lot of your health problems. You might be having 2 cups of coffee in the morning and a couple of cocktails in the evening, or then you're even further dehydrated. For every cup of coffee, cup of tea, or alcoholic beverage, you got to drink 3 cups of water to offset the diuresis effects. The problem is if you're drinking a lot of tap water, you're getting a lot of chlorine, and you might be getting a lot of fluoride as well, and you wonder why you're going to get colorectal cancer or some kind of cancer down the road. So you got to drink at least reverse osmosis if you're putting it on the sink, some sort of ionization or reverse osmosis to actually filter the harmful chemicals, and then you can realkalize it by chopping up some fruit and vegetables and putting it in there and sprinkling a little bit of pink Himalayan sea salt or Celtic sea salt to help realkalize the water so it's pure and then it's not acidic, okay? So you got to drink more water, number 1, all right? Number 2, you got to clean your eyelashes. Eyelashes are one of the dirtiest parts of your body, believe it or not. You don't realize that, but we brush our teeth, we brush our hair, we wash our hair, wash under our arms, but how many people scrub your eyelashes? None of you do, all right? So scrubbing your eyelashes with some baby shampoo, regular shampoo, OcuSoft foam. You can get through eye doctors. You can get it over the counter. You can get all of this on our website at Fortifeye.com. So we got to clean the lids. So we clean the lids because the lids harbor bacteria, viruses, and mites, especially something called Demodex, not to mention antigens that cause allergies. So those are 4 things that hang out in your eyelashes, and these little critters crawl into the glands at night when you're sleeping, and they lay eggs. That's why when you wake up in the morning, you're matted shut. Your eyes are matted shut, and they feel kind of funky, and you have crusty stuff all over them. So what you do is, once again, clean them, especially before you go to bed. So now we drink water, we clean the lids, we heat them. We want to heat up the lids, the meibomian glands. We want to heat these up because all of this debris trapped from all of these little pathogens causes a waxy material in the meibomian glands to clog these meibomian glands, which are crucial for secreting the outer lipid layer or cushioning layer of your tear film, which makes your eyes feel better. So we heat them up a couple of times a day with a hot washcloth or the Brooder mask I like the best. Brooder mask is like $20-25. You can get it on our website, Fortifeye.com. And you put it in the microwave for 20-25 seconds and then let it just Velcro over your face for 10 minutes twice a day. That'll help, all right? Then you got to use a good lubricant in your eyes, something like Oasis Tears Plus, Blink Preservative Tear, or Fresh Coat. One of those 3 are very good lubricants. Once again, anything I talk about in this show, you can get through your eye doctor or at Lange Eye Institute, the Lange Nutrition Center in Ocala, or you can go to Fortifeye.com, Fortifeye.com, and get anything I always talk about. It makes it convenient for you. So now we heat the lids, we clean the lids, all right? We lubricate the eyes, and we drink more water. And then finally, nutrification of the glands. It's crucial. A good omega-3 fish oil is crucial. Triglyceride form. Don't waste your time buying the stuff over the counter because 98% of it has ethanol in it and impurities in it. It may be more harmful than beneficial. There are a couple of brands that are good that you can buy over the counter, but they're close to $50. I developed Fortifeye Super Omega 10 years ago, and then Fortifeye Super Omega 3 Max just about 8-9 months ago. And it's become one of the leaders recommended by doctors because the concentration is high, the purity is the best, it's made in Norway, and the price is right. Much cheaper than prescription fish oil, much better. and much cheaper than some of the competitors out there that are making a product similar to it. So check it out, Fortifeye Super Omega, or better yet, Fortifeye Super Omega 3 Max. So now you've learned that you got to hydrate, drink more water, clean your lids, heat your lids, nutrify your lids, and lubricate with a good lubricant. And the lion's share of you with dry eyes are going to benefit from this, all right? However, there's some of you that will not, and the ones of you that will not benefit from this, ask your optometrist or ophthalmologist to put some little plugs in your ducts, your drainage ducts. This is called punctal occlusion for dry eye, okay? Punctal occlusion for dry eye. They do it in 2 phases. Collagen plugs first, all right? Collagen plugs dissolve in a few days. If you get symptomatic relief, your eyes feel much better, and then they dissolve and your symptoms come back, that's a positive sign for the doctor to put the permanent ones in. They're made of a soft medical silicone. They go in very easily. It takes 1 minute. It's painless. You don't even need an anesthetic for this, and it's covered by your insurance. I've done thousands of these, and it works. And the good thing is it's covered by insurance. So now we see a way we can really help dry eye considerably. Now, let's say we've tried all of this, and you still have dry eyes, and the reason your eyes are dry is because your meibomian glands are clogged. We're going to talk about a new generation therapy for that in just a minute, but I'm going to open up the phone lines. If you've got a question, give me a call, 877-943-9673. Write this down. I'm going to give it to you a little slower, 877-943-9673. And I think we're actually coming in through Instagram. We're coming through Periscope, Facebook, maybe LinkedIn, Twitter, and YouTube, and a few others. So we're out there on social media, and I see a lot of you are asking questions, but I can't really see it because it's too far away, but that's okay. One more time, 1-877-943-9673. All right, so let's say you have dry eyes and you've tried everything I've talked about and you're still having issues. And let's look at the lower lid in a magnifying mirror, and it looks kind of inflamed, right? Baggy, inflamed. Well, chances are these glands, these meibomian glands, are so blocked and so clogged that nothing you do is really helping. So there's a lot of technology out there that people have been using, things like LipiFlow, IPL, laser, meibomian gland probing, and all of these have some benefits, all of them, okay? But they're relatively expensive and they take a while. So Alcon has a new product called iLux, all right? Write that down, iLux, the letter I and then LUX. This new product heats up the glands, all right? And you have a technician or a doctor doing this on you. It's just a device that's placed on your lower lids and your upper lids, and it heats up these glands and then squeezes the glands and actually squeezes all of the bacteria, the viruses, the antigens, the mite eggs out of your lids out of your glands out onto your lids, and then we clean it off. So it heats them and it cleans them. Takes about 15 minutes tops. And we do it in segments, in sections. So we do your temporal lower lid, your nasal lower lid, that right eye and the left eye, and then we do the upper lids. So it's painless and it works. So the patients that we've done this on have been amazed because we've tried everything and nothing has helped until we actually have heated up the glands and squeezed those glands. The only drawback is it's not covered by insurance. It's not covered by Medicare. Some doctors are charging $999 or more for this procedure. We charge $599 for it, so it's about $600 to do this, but it is very well worth it, especially if you're one of those that have these blocked meibomian glands. All right, so that's my spiel on dry eyes. So obviously the title on the YouTube segment, and the title for the show is probably going to be Dry Eye Treatments, Natural Approaches to Helping Dry Eye that we went over today. Once again, come out and watch us at the races, the Winterfest at Sebring. That's January 15th through the 19th. They're going to have some great racing, night racing, all-day racing. I'll be racing probably Saturday and Sunday in the advanced class. So Winterfest, Sebring, that's PBOC Winterfest. It's a big race. And I don't think it's very expensive to the public. It might even be free to the public. I'm not sure. But if so, it's not very expensive at all. All right. So this morning, we're not getting a lot of calls, so you must be really in tune and just invigorated by this topic that we're talking about. Let me give you the number again, 1-877-943-9673. That's 1-877-943-9673. Now, from a nutritional standpoint for your dry eye, I'm going to brag a little bit. There is not anything better on the market from a nutritional standpoint for dry eye and meibomian gland dysfunction than a product I developed, believe it or not, called Fortifeye Advanced Dry Eye Therapy. Fortifeye Advanced Dry Eye Therapy is a combination of the triglyceride form omega-3 that we talk about, a combination of Fortifeye Focus, which is lutein, zeaxanthin, and astaxanthin, and studies do indicate, especially the astaxanthin does help dry eye and dry mouth for all of you that have Sjogren's syndrome. But lutein has been shown to help dry eye as well, but it also, the lutein and zeaxanthin protects you from the digital world that we live in. The computer, the blue light you're being exposed to from your iPad, your iPhone, or your whatever type phone you have, your laptop and your regular computer, the television, the LED lights, the fluorescent lights. We're being bombarded by blue light, a frequency between 400 and 450 nanometers that's really damaging our retinas, also causing the pineal gland not to secrete melatonin and interfering with your sleep. You're not going through REM phase or REM phase of sleep, and that is not good for your health. So a little pill, a little black pill with a little red mark on it called Fortifeye Focus can help absorb the harmful blue lights. It can help give you energy because it goes and supports mitochondrial health with ATP. It increases focusing ability in your eye. I'm 58. I don't need reading glasses. When I was 50, I did. So it's great for anybody on the computer. And the final piece of that puzzle for nutritional approach for dry eye is gamma linolic acid, or GLA, okay? That is from black currant seed oil. I created one of the most potent GLL supplements on the market, 1 gel cap per day. So the combination of those is in one box. It's the Fortifeye Super Omega, Fortifeye Focus, and Fortifeye black currant seed oil GLA. 3 bottles in a box, discounted to $62. If you're on the website, you go to fortifeye.com. There's a little scrolling deal at the top that gives you 15% off with a special code as long as you buy, I think it's $150 worth. But you also get free shipping with that, so that helps out. All right, we do have some people on hold. I'm going to give you the phone number one more time, and then we're going to take some calls. 1-877-943-9673. 1-877-943-9673. Remember to follow me on Instagram, Facebook, Twitter, LinkedIn, all of those ways, Pinterest. You can follow me. I give a lot of valuable codes during the week that give some discounts via especially Instagram and Facebook and Twitter. All right, let's go to the phones. We're going to see, I think it's Benny in Gainesville. Good morning. Thanks for holding.
Thank you. How are you this morning?
Fantastic. And yourself?
Okay. I have a macular degeneration in one eye, and I've been taking a shot to get that help.
Mm-hmm.
Is that your dry eye you're talking about, or wet eye, or what?
Well, that would be wet macular degeneration. So macular degeneration kind of comes in 2 flavors in layman's terms, dry and wet. Dry is the most common type, but it has 20 to 30% chance of turning wet. Wet is the most visually devastating, but the wet is the type that can actually be treated with an Avastin injection, a Lucentis, and Eylea, and there's some other types of injections that have anti-VEGF activity, okay? And these injections have been a godsend for our patients and our retina department at the Lange Eye Institute, because these are patients that used to be going blind from the wet form of macular degeneration that were preserving their vision, many of them dramatically. So the combination of taking the right diet, eating the right foods, right, heavy on dark green leafy vegetables that are organic and cooked, right, wild Alaskan salmon, orange bell peppers, goji berries, and eggs. That combination can help your retina. You know, following your retina specialist advice, having the injections per their directions, and then taking a supplement at a minimum like the Fortifeye Focus or the Fortifeye AREDS 2 Plus. Both of those are very good. And then you could always take the Fortifeye Macular Defense, and I like the zinc-free Macular Defense. If you don't have a DNA test done, you don't know. It's best not to have a lot of zinc if you have macular degeneration. So I don't recommend these over-the-counter vitamins that have 80 milligrams of zinc at all, because nobody needs more than 40 milligrams of zinc at a sitting in a supplement. Nobody. It can actually cause some neurodegenerative problems, some prostate problems, some kidney problems. So we don't want to be taking super high dosages of zinc.
Well, there's a pill that I've been taking, that Pervision or something like that. Little.
Right. So I'm not in love with that pill. Not to knock the company, but that's based on the AREDS-2 study, age-related eye disease study. And the problem with the one pill that you just mentioned, it has 400 units of synthetic vitamin E. And if you Google what synthetic vitamin E can do for you, it's not the best thing in the world. It has 80 milligrams of zinc oxide. Zinc oxide is the worst form of zinc. And in my opinion, and most nutritional experts, that's way too much zinc, okay? And so I don't recommend that. I created one that's called AREDS-2 Plus. We cut the zinc back to 30 milligrams, did away with all the copper. We added resveratrol and astaxanthin to have some legitimate nutrients that benefit you. Still has the same amount of lutein and zeaxanthin, same amount of vitamin C, the same amount of vitamin E, but we went to natural vitamin E, and we didn't put it in a dye-laced capsule. No dyes. It's in a vegetable capsule. So you get the benefits of the age-related eye disease study with some newer nutrients without any of the synthetic garbage, okay?
How do you get hold of that?
You can go to the website at fortifeye.com. That's the simplest. If you go to the website and then just look at AREDS-2 Plus and actually look at Focus. Many patients I put on both, okay? And you can look at all the research papers on there under Fortifeye Focus. You can read for hours about the benefits of these nutrients that are in these supplements.
Well, I have to maintain the injections the rest of my life.
That's a really good question. I'm glad you brought that up because I was just talking with one of the world's leading retina specialists for about 3 hours the other night, and he does a lot of studies in this area. And he was telling me, so there's a lot of doctors out there that are giving you an injection every 4 to 6 weeks, and some of them had 50 and 100 injections. Well, there is some evidence now that prolonged injections for a long period of time may actually thin out the choriocapillaries, the choroid, and cause basically deprivation of blood flow to the retina. So long term, it may not be good, and it may cause the opposite of neuroprotection. You may lose some of the neuroprotective properties. But you got to follow your retina specialist advice on this, okay? And you can always say, hey, doc, I heard, and you can even say the source, that maybe long-term injections every 4 weeks for months and years may not be the best thing. Can I... And it also depends how stable you are. So if they did the injection and the swelling of your retina went down and everything improved, sometimes they can say, well, let's take a wait and see attitude. Let's keep an eye on you. Let's have you in every month. We'll scan you with the OCT scan. That's a non-invasive scan. And see if your swelling is still down, everything looks good, then maybe we don't inject you. Basically, the gist of this story is maybe we can start doing a few less injections than we thought in the past. And it doesn't hurt asking your doctor if he can do that.
Well, I will do that. I've been taking these injections. I'm on my 4th one every 6 weeks, and they have been reduction in the swelling.
Right. Yeah, so 4 injections is not a big deal, okay? I mean, that's probably the gold standard, all right? But I've got patients that have had 100 injections, okay? And so not through us, that I inherit. And a lot of those, we've stopped the injections and we've adjusted their diet and put them on the right supplements. And many of those, we stopped the injections over a year ago or even a year and a half, 2 years ago, and we haven't had one injection since, all right? By the same token, some of those have to continuously have injections. But remember, we like to do the minimum amount of injections that get the job done. And I've preached that for years. The minimum amount of surgery, the minimum amount of medication that gets the job done.
What is that website again, please?
Fortifeye.com. I'll spell it to you. F-O-R.
That's okay. I got it. Fortified.
Yeah, Fortifeye. It's Fortifeye. So remember, I'm an eye doctor, so E-Y-E on the end. Fortif and then I. Fortifeye. Okay?
Thank you very much for the information, taking my call.
My pleasure. You hang in there and good luck.
Thank you. I might see you down the road.
All right. I'll look forward to it. Take care.
All right. Thank you.
All right. I want to take this opportunity to wish everybody a very happy, healthy holiday season. Merry Christmas. Happy New Year. Happy Kwanzaa. Happy Hanukkah. Hopefully I covered all my bases. All right. Didn't take anybody off. All right. Phone lines are open. 1-877-943-9673. Let me give you the phone number before we get the next caller. Let me give you the phone number for Fortifeye Vitamins. And this is open Monday through Friday. I don't make them work on the weekend. However, in the new year, we may be open in the mornings at Fortifeye in the Lange Nutrition Center on Saturdays in the new year. So the toll-free number for Fortifeye Vitamins, and this goes directly to the Lange Nutrition Center. You can always talk to Doc Hall via that phone. It is 866-503-9746. One more time, 866-503-9746. All right, and we're going to go to the next call of the day. I think it's Ada or Aid in Seminole. Good morning. Welcome to the program.
Hey, it's Abe, like Lincoln. Abe, how you doing, sir?
Oh, Abe. Hey, Abe. How are you?
Real good. Hey, one thing, you're not transmitting on 8:20 a.m., so I got that on tube, which is great. So that way I knew you were on and could talk to you. Anyway, my question is, and I'm looking at nutrition, maybe you have some other suggestions. I have psoriasis really bad. I also have psoriatic arthritis. I know you're an eye doctor, but I also know you're a great nutritionist. I do buy vitamins from you. I actually talked to Dr. Hull a couple weeks ago first, and then he transmitted me to somebody else. Anyway, do you have any suggestions as to what to do? I went to a wellness center in Clearwater, and it really didn't do anything for me. And I'm trying to, and I don't want to take a drug that's going to kill me on the inside out and maybe make the psoriasis go away. But is there anything you can suggest?
That's interesting. So psoriasis is a problem, as you know, on the skin as well as on the joints, all right? So psoriatic arthritis can be very, very painful. And there are some things that can help, absolutely. I've seen many, many patients that have improved with their psoriasis on the dermatological side as well as on the inflammation in their joints. And something I talked about earlier was Fortifeye Advanced Dry Eye Therapy, okay? This has some things that are amazing for the skin and have been proven to actually help psoriasis, but amazing for the joints as well, all right? So omega-3 in the triglyceride form, it's got to be the triglyceride form, not this stuff that has ethanol in it that you buy over the counter. So our Fortifeye Super Omega can help both, all right? It can help arthritis, it can help skin problems, especially psoriasis. But the big one is the GLA from black currant seed oil and the astaxanthin, lutein, and zeaxanthin from the Fortifeye Focus. Those combinations, I've got a ton of patients with this condition. And, a lot of patients, it's bad. It's to the point where they won't wear shorts or tank tops or anything because
that's where I'm at right now.
Right. It's on their elbows. It's on their knees. It gets in their eye. It's called psoriatic blepharitis. And so I would highly recommend getting Fortifeye Advanced Dry Eye Therapy. The combination of those is discounted to $62. You buy it on the website. You can get another 15% off. Look at the little code, and it gives free shipping. If you're in Ocala, you can go into the Lange Nutrition Center, and we'll give you a discount as well. So I would highly recommend trying that, and you got to try it. It's not going to go away in a week. You got to be on it for 3 to 4 months. But what you'll notice is inflammatory markers in your blood, things like triglycerides as well, even cholesterol ratios, these things will all improve. So if we can lower inflammation in the body and the skin and then give nutrients that actually help with joint health and skin health, it's a win-win situation. And then the other thing you need to do since you're in Florida is get out to the Gulf of Mexico and get some sun and get in the salt water. So swimming in salt water and the vitamin D from the sun, very effective. So if you're not going to get vitamin D, you need to be taking at least 2,000 units of vitamin D3, sometimes even more, depending on your size and the color of your hair and your eyes. But since you're in Florida, you can get to the beach every now and then, just depending on how often you work. So I would try the Fortifeye Advanced Dry Eye Therapy. I would try getting some sunshine, getting in the salt water, do those things. You got to get plenty of sleep, because if you don't get a good night's sleep, inflammation in your skin and your body actually goes rampant. So you want to try to get enough sleep, and then hydration, like we talked about early in the program. Almost the same things for dry eye are good for psoriasis and good for psoriatic arthritis. And then obviously you've probably done corticosteroid creams and probably tar baths and things like that. And, you know, a lot of those don't help. And there are some medications out there now, but I got to tell you, some of these medications for psoriasis are super potent. And if you look at the side effect profile, a lot of bad side effects. So remember, the least amount of medication that gets the job done.
What's the black currant seed oil?
So the black currant seed oil is high in something called GLA, all right, gamma linolic acid.
Okay.
And that is amazing for the skin. It actually stimulates something called prostaglandin PGE1. That gets kind of complicated, but that's a way of stimulating the good oils in your body, all right? And remember, these are little dry patches all over your body. And so
Sure.
the gamma linolic acid is very good. You can get it 3 other ways. You can get it from spirulina. You can get it from borage oil, and you can get it from evening primrose oil. I like it from black currant seed oil the best because I got a non-GMO source, and most of the others have all been genetically modified, so who knows what else you're getting in with it.
Fantastic. Hey, thank you very, very much. Really enjoy your program. I will follow you over to 860 after this, but it's really good. Thank you, and God bless you, sir, for being there. Thank you.
All right, thank you.
Bye-bye.
All right, so now we know why we're not getting a lot of phone calls because we're not on 8:20 a.m. That's okay because 860's cranking it, and a lot of people are probably switching the dials. All right, I'm going to give you the phone number, and then we're going to take a break. So let me give you the phone number. It's 877-943-9673. 877-943-9673. And we're going to go to a commercial break right here in just a second. And then I'll be back in about probably 3 more minutes. So stay tuned.
You're listening to Ask the Doctor with Dr. Michael Lange. The doctor is in.
There's nothing more frustrating and irritating than chronic dry eye. It never stops. The itching, the scratching feeling, the fatigue and weariness. If you're suffering from chronic dry eye, go to Fortifeye.com and join thousands who've discovered Fortifeye Advanced Dry Eye Therapy, a combination of Fortifeye Super Omega, Fortifeye Focus, and Fortifeye Black Currant Oil GLA. Fortifeye Advanced Dry Eye Therapy works to address oxidation and inflammation in the eye and the entire body. This combination, once only available to patients in the doctor's office, has now become available to you. And already, countless numbers of listeners have found relief with Fortifeye Advanced Dry Eye Therapy. If you or someone you care about struggles with dry, itchy, exhausted eyes, order Fortifeye Advanced Dry Eye Therapy today at Fortifeye.com. That's Fortifeye.com or call 866-503-9746. That's 866-503-9746 and at Fortifeye.com.
While others are hitting happy hour, you're hitting the gym. While they're hoisting mugs, you're lifting kettlebells. You owe it to yourself to get the most out of your fitness regimen before and after your workout with Fortifeye Fit. Fortifeye Fit's power-packed formula is designed to enhance muscle synthesis, strength, and endurance. All evidence-based nutrients in this proprietary formula are well documented and backed in good clinical studies, taken before and after your workout. Fortifeye Fit is also hailed for what it doesn't contain. No dyes, artificial flavors, or carrageenan. With Fortifeye Fit, you get all you need to get the most out of your workout without needless additives and sketchy sweeteners. Order Fortifeye Fit today at Fortifeye.com. That's Fortifeye.com or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at Fortifeye.com.
Okay, good morning. Welcome back to Ask the Doctor. We're going to do this the old-fashioned way. We're on 97.3 FM, The Sky. So you guys, we're pulling a solo right now on The Sky. It's my old standby radio station. A lot of the other stations are down for whatever reason. You will be able to switch to 860 AM in Tampa the next hour. So all of you out there, let your friends know, 860 AM in Tampa, or 9:30 a.m. in Sarasota. And you will be able to check me out right now live on Facebook, Michael Lang OD, or Dr. Michael Lang, or Fortifeye on Facebook, Instagram, also Twitter and YouTube. So 97.3 FM Sky, you guys give me a call. Let me know we're coming loud and clear. We must be because we're getting loaded up on calls now. So we're going to go to the first caller. I think it's probably Judy in Ocala. Judy, good morning.
Good morning, Dr. Lang. I've been wanting to call for a long time to give you some praise.
Well,
I'm one of your patients, and when I was 70 in Texas, they discovered for the first time that I was seeing double, and one of them was higher than the other.
Mm-hmm.
And for 10 years, nobody else could correct my prisms. They said they couldn't be any stronger.
Right.
When I was 80 and came to see you for the first time, I put on a pair of glasses and could see perfect.
Oh, excellent.
Unbelievable. A miracle, but yet how sad, right? Now, you also said something, I want to make sure I got it right, that after you have cataract surgery, you must have really good sunglass lens that filter out the blue ray or whatever, or you will get macular degeneration. Did I get that right?
Yes, ma'am, you did. I don't beat around the bush, do I? Yes. So it is evident that after cataract surgery, you're more prone to having macular degeneration if you do not protect your retina from the blue light. And that's why I always tell people, if you're going to wear sunglasses and you're going to try to save money and not buy a good sunglass like Maui Jim, then make sure they're brown sunglasses, not the gray. Never blue sunglasses. So the brown sunglasses have some inherent blue filtering properties, but there's a lens called True Blue that we sell. That's a polarized lens that actually filters out all the harmful sun, and it can be in gray or brown. Maui Jim, they all filter the blue light as well. So it's crucial after cataract surgery to wear blue filtering lenses. It's even a good idea if you're on the computer, the iPad, the iPhone a lot, even if it doesn't have a prescription, to wear a lens like Blue Light Defense, Blue Light Shield, or True Blue. One of those three, we have all three of those available at the Lange Eye Institute. You can even get at the Lange Nutrition Center non-prescription blue filtering lenses that are totally clear. And then on top of that, Judy, you want to take Fortifeye Focus or something that has lutein, zeaxanthin, and astaxanthin in it. Quite frankly, we're the only one in the United States that isn't a fish gelatin with an olive oil delivery system that has lutein, zeaxanthin, and 6 milligrams of astaxanthin, because those will help not only lower inflammation and oxidation, which is aging in the eye, but will actually help filter the harmful blue light. I've got my 13-year-old daughter on it, got my 92-year-old mom on it, and thousands of other people.
Yes, my prescription glasses I've got from you that have that, and then I got the good sunglasses from you. I have that, and I must say that I'm 81 and a half now, and I have perfect health. I don't even have to take my blood pressure medicine anymore, but I'm on all your supplements, and I bought your protein by the case. But now I have a very important question. Mm-hmm. I'm joining the new gym that's gone up here in Ocala, and they have this red light booth where it's all reflectors, and you go in there for 6 to 8 minutes. And I'm wondering if that light or that treatment, if you need any protection for your eyes when you're in there.
Yes, you probably need to keep your eyes closed. And so you're joining Gold's Gym, aren't you?
Oh, yes, I was one of the first members. They're not opening till Monday.
Outstanding. And I like seeing an 81-year-old going to the gym, taking our supplements. Remember, age is just it's kind of in the number. And in the mind, you are much younger than 81. And in your body, you're going to be much younger. God made a really good body if we give it the right fuel. And that's what you're doing. Yes, keep your eyes closed when you're in that. That's probably an infrared sauna. Is that what it is?
No, the sauna is different. This is some other kind of machine. I'll get the name and I'll call you back on that because
okay.
I asked them, and since we have to protect from the blue rays after having cataract, I thought, what if you went in there and what if it was something harmful to your eyes? And I think I really want to know that before I get in there.
I am sure Dr. Hall would know because, he was the first to own a Gold's Gym in Florida. And he owned the Doc Hall Fitness and Wellness Center, and now he runs the Lange Nutrition Center on the advisory board for Fortifeye. So I know Doc Hall is probably listening to this right now. He's trying to tell me what it is, but I can't get it through the brain waves that he's sending. So I know Doc Hall will know. And if you find out exactly what it is, I can tell you more about it.
Okay, thank you so much. I'll see you soon for a pressure check.
All right. Take care.
Thank you.
Bye-bye.
Bye.
All right. Now we're going to go to Nita in Clearwater. Nita, good morning. Welcome to the program.
Good morning. I have my optometrist has told me that I am getting close to having to have cataracts removed, and I just want to know how the procedure is. Is it painful or
okay?
What should I do?
So, in the hands of a competent ophthalmologist that's done plenty of cataract surgery, it's a fairly quick procedure, painless procedure. Depending on where you go, they'll either start an IV and give you a little refreshment in your IV that helps you relax, something like Versed. But certain doctors will give you a little cocktail that you drink first without ever starting an IV that helps you relax also. And then topical anesthesia, just a drop of a cane type of drug that numbs your eye. And then a combination of ultrasound and laser will remove the cataract. No sutures at all. It's called a clear cornea small incision. And they put an implant in place. They take the human crystalline lens out that's getting foggy and yellow, and they put an implant in place that has your exact prescription so you can see clearly. Now, it comes in 3 flavors, basically. One that's covered by your insurance, all right? That's a basic lens. It removes the human crystalline lens. It gives you really good distance vision, but you still need glasses for up close. And depending if you had a lot of astigmatism, you still have a little astigmatism after the procedure. So you might still wear glasses that will just be much clearer. Number 2 would be a astigmatic implant, a toric implant that corrects your astigmatism, giving you better distance vision, but you still need to wear reading glasses and computer glasses. And number 3 would be a multifocal implant. And a multifocal implant allows you to see in the distance and up close and everywhere in between. It sounds perfect, doesn't it? Well, the success rate's only about 83, 84%. So that means 84 out of 100 people are happy they spent the $6,000 for that. But that also means that 16 out of 100 people are pissed off and thought they got ripped off. So you got to be very careful doing a multifocal implant. Once again, you got to pick and choose the patient very carefully. You got to listen to what they do. If they drive a lot at night and they do a lot of sports, probably not the best candidate for a multifocal implant. If they don't do much night driving and do a lot of reading or a lot of crossword puzzles and stuff like that, then maybe a multifocal implant would be good for them. The gist of this story is you got to talk to your doctor, either your optometrist that's making the referral or the ophthalmologist that's doing the surgery. Talk with them, let them know what your expectations are and your lifestyle.
Okay, well, I have a hard time seeing at night when I'm driving. Is there anything that I could do?
Well, a lot of night vision problems are related to A, cataracts, all right? So having your cataract removed would help. B, dry eye. Everybody has dry eye at nighttime. So everything we talked about in this program regarding dry eye will be beneficial. Taking our advanced dry eye therapy by Fortifeye Vitamins would help. Using like Oasis Tears Plus. If you go to our website at fortifeye.com, you can see a whole section I've written on dry eye, and it talks about nutrition for dry eye. And then any type of nutritional deficiency can cause impaired night vision as well. So just to make sure you don't have any type of nutritional deficiency in the arena of carotenoids, especially taking something like Fortifeye Complete. That's a multivitamin, eye vitamin, veggie fruit cap enzyme, and 1 USP certified tablet. So Fortifeye Complete covers all those bases, making sure. So use the lubricants for your eye, take the nutrients, Fortifeye Advanced Dry Eye Therapy, and maybe consider Fortifeye Complete as well. And then give it about 3-4 months and see how you do. Obviously, seeing your eye doctor routinely is recommended.
Okay. Thank you very much.
All right, Miss Nita, you have a great day. God bless you.
You too. Bye-bye.
All right, we're on a roll. I think we do have time for some more calls. Let's go to Sue in Ocala. Good morning, Sue.
Yeah, good morning, Dr. Lane. I'd like to ask you, how much magnesium you can take?
Wow, that's a good question. You can load up on magnesium, and literally you can take thousands of milligrams, and your body will know if you're getting too much. You know why?
Well, how do you know?
You would start having the runs. You would have diarrhea, basically, all right? I always recommend, starting low. I mean, 100.
I never have diarrhea, no matter what I eat.
All right, so 100 to 250 milligrams of something like magnesium citrate is probably fine.
I take 500.
That's fine. 500 milligrams is fine.
It's a small capsule, so I don't know if I should.
Make sure it is not magnesium oxide. Okay. All the other magnesiums are pretty good. Magnesium glutamate, magnesium chelate, magnesium citrate. Just do not take magnesium oxide. If it has magnesium oxide in it, it's not going to do anything.
No. Yeah. Okay. Anyway, I'd like to know, do you have anything you sell like greens, a lot of greens mixed together on powder?
Yes, we do. I developed one of the first in the world, a superfood that is FODMAP free. That's FODMAP, FODMAP free, gluten free, and all certified organic. So it doesn't have any of the fruits and vegetables that cause fermentation and bloating, all right? And so anybody with IBS, irritable bowel syndrome, can take this because they can't take things that have FODMAP. So it's a superfood. It's called Fortifeye Organic Blue-Green Superfood, okay? And it is...
so it's a lot of greens mixed together.
Right. It's spirulina, spinach, kale, barley grass.
I take that.
Okay.
I take that, but
we're out of time. I got to roll, okay? Thanks for tuning in, listening to Ask the Doctor. I'm out of here. Have a great day.